girl gang, it's Dr. Joy here and you are watching Delivering Joy MD. So welcome to Well Woman Wednesdays, and today we are continuing our series on period problems. So girl, today we are talking all about adenomyosis. That's right, adenomyosis. Keep watching to learn more about this period problem. All right, girl gang, so let's first break down the name of this disorder. It's called adenomyosis. Adenomyosis. And so a lot of people, have heard of this, but just have trouble sometimes articulating it, which I know I have trouble articulating lots of words. But adenomyosis is actually a condition where some of the cells that should be lining the inside of the uterus have actually migrated out into the muscle wall or the myometrium of the uterus. And so this is a condition that is similar to endometriosis, which has been in the news a lot lately because there are lots of new treatments that are coming out for endometriosis. Similarly to endometriosis, adenomyosis can cause some severe pelvic pain during menstrual cycles. And so with adenomyosis, those cells that are migrating from the inside lining of the uterus out into the muscle wall of the uterus are actually having bleeding every month. So if you remember when we talked about where periods come from and the endometrial lining or the lining on the inside of the uterus, we said that those cells actually shed and bleed every month, and that's how we actually have a menstrual cycle. Now with adenomyosis, these lining cells migrate out into the muscle cells, and every month when it's time for your period, they actually bleed. And this really can cause the muscle wall of the uterus to become thickened, and also you can see pockets of fluid inside of that muscle wall on transvaginal ultrasound. Now, speaking of transvaginal ultrasound, that is one of the modalities of imaging tests that we can use to diagnose adenomyosis. But adenomyosis can be pretty hard to diagnose sometimes because if you see an enlarged uterus that just has thickening of the muscle wall, it could be that that woman just has an extra muscular uterus. So the uterus is made out of smooth muscle cells. One thing that we should note about adenomyosis and how it causes heavy cycles is that the muscle wall of the uterus is not able to cramp down the way that it needs to in order to stop bleeding. So women with adenomyosis may find themselves with heavier periods or bleeding in between periods or periods that seem to stop and start all throughout the month. So if that's you, make sure that you bring up this topic of adenomyosis with your gynecologist the next time you're there. So when we see that lining of the uterus is thick, or if we see that it appears that there seems to be cells that are from the lining of the uterus inside of the muscle, then we can see that. Unfortunately, transvaginal ultrasound may not even reveal adenomyosis, just like it may not reveal endometriosis. So MRI or magnetic resonance imaging is also a way that we can look for adenomyosis if we're suspicious for it. However, again, this is not absolutely 100% diagnostic. So a lot of times adenomyosis has been so troublesome to a woman where she's having horribly painful periods or having really heavy periods that she's usually going to end up having a hysterectomy. And that is when we're actually able to 100% sure diagnose adenomyosis. Now, hysterectomy is a big step. So I usually recommend when I suspect that a woman may have adenomyosis, that she go ahead and start a conservative method first. And by conservative methods, I mean like oral birth control pills or taking some pain medications called non-steroidal anti-inflammatory drugs or NSAIDs several days before her period and during the first several days of her period. In addition, we can also use things like the Mirena IUD to help with adenomyosis. And if a woman is having adenomyosis symptoms like heavy period, there's also an outpatient procedure that's called an endometrial ablation. And that's where we actually burn the inside lining of the uterus to try to help a woman stop having menstrual periods altogether. So while adenomyosis can be really difficult to identify and diagnose, it can also be a little tricky to treat. I always talk to my patients about adenomyosis, especially if they have a normal pelvic ultrasound or a normal pelvic MRI, because sometimes adenomyosis is sneaky and it's able to hide inside the muscle lining of the uterus. So if you have been having really heavy periods or periods that are extremely painful, maybe ask about imaging to look for adenomyosis. Again, it is tricky to diagnose and tricky to treat, but if we're able to find it, then we are able to treat it pretty effectively with some of the conservative measures. But occasionally, these women who have adenomyosis may actually need hysterectomy. I hope that this video has been helpful in describing adenomyosis, which is one of our Palm-Cohen terms that we've been learning about. So make sure you check us out next week. Like this video and subscribe so that you don't miss next week's topic. All right, girl gang, we'll check you next time. Peace.